and we will be discussing a short topic of MRI of the ankle and foot, why and how of it. That is how we do it and what all we need to see. So when we are doing a MRI of the ankle or the foot, so we can assess the neuropathologies. We can see whether there is a primary or a secondary arthritis, if there is a congenital or developmental coalition disorder, if there is synovial pathologies, if there is tendon disorder, ligament abnormality, if there is osteochondral defect, if there is a sinus tarsus syndrome, or there is a bone or soft tissue tumor. So in MRI, the role of a technology is very important as the history there, the person who have the first and direct interaction with the patient, they can take the history, positioning is important, and they need to follow imaging protocol. It is a very important aspect to know that whenever we are imaging in MRI ankle and foot, both should be done in as a two different scan and it should not be completely done as a single joint. This is the positioning to be done for the ankle, where the ankle joint should be kept at 90 degrees in a dedicated ankle coil. And when we are planning for a sagittal, it should be in plane parallel to the plantar fascia. In axial plane, it should be perpendicular to the axis of the tibia and fibula, and in the coronal plane, again, it should be along the axis of the long axis of the tibia. When we are planning a foot, so it should be again kept in a little flexed plantar flexion of the foot with a support so that there is no movement of the patient. And we should, the planes which are planned for the foot is long axis along the sagittal plane, along the long axis of the metatarsals. In axial plane, it should be perpendicular to the metatarsal, and again in the axial plane, it should be along the long axis of the metatarsals. So these are the four basic sequences which should be done. One is a fluid sensitive sequence, that is either it should be stir or a proton density fat surface image, T1 weighted image, T2 weighted image, and cartilage imaging for the by using the gradient imaging. Coming to the anatomy of the ankle, there are three anterior tendons, three posteromedial tendons, and two peroneal tendons. There are medial, lateral, and syndesmotic ligaments. So these are the basic stabilizers of the ankle. Coming to the tendons, so this is the axial view of the ankle joint. This is the proximal segment. This is the distal segment. So in the this is the anterior compartment. This is the posterior compartment. And in anteriorly, as we have learned from the anatomy days, as we move from medial to lateral, in the anterior compartment, there is the Tom, Harry, and Dick. That is tibialis anterior, flexor hallucis longus, and flexor digitorum longus. Similarly, posteriorly, when we come from medial to lateral, it is Tom, Dick, and Harry. So tibialis posterior, extensor digitorum longus, and extensor hallucis longus. The two peroneal tendons which lie in the posterior lateral aspect of the peroneus longus and the brevis, which are also seen. This is the fat surface proton density image, and this is the T1 weighted image. As we move on towards the distal aspects, that is a segment section which is more distal to the above two segments, we are able to see all the three tendons nicely in the posterolateral aspect, posteromedial aspect, anterior aspect, as well as the lateral aspect. And the posterior tendon which you are seeing, the dark structure, that is the Achilles tendon. Coming to the ligaments, lateral, medial, and the posterior ligaments. So coming to the lateral ligaments, so this is the anatomical diagram showing the bones. So this is the tibia, this is the calcaneum, this is the talus. So the ligament which gives the lateral stability are the tibio, anterior tibio talar ligament, and then there is the tibio fibular ligament and the calcaneo fibular ligament. So when we see in the MRI, so this is the lateral compartment, this is the fibula. So the fibula which is attaching to the talus is the anterior talofibular ligament, and it is also has a posterior talofibular ligament, and in the little distal view, we are able to see that this is the peroneal tendon, and deep to it the structure which is seen as the calcaneofibular ligament. Coming to the medial ligament complex, it is basically called as the deltoid ligament complex, and along with that there is a spring ligament complex. It consists of a large number of ligaments, but the clinical importance of the MRI which we see commonly are the, so this is the medial aspect of the tibia, so and this is the talus, this is the navicular, this is the calcanea. So tibio-talar, tibio-calcaneal, this is the anterior tibiotalar, this is the posterior tibiotalar, this is the tibiocalcaneal, and this is the tibio spring ligament, and this is the spring ligament. So spring ligament again has the various components which I will be talking about. So when we see in the MRI, this is the medial aspect. This is the abnormality which you are seeing in the medial dome of the talus. There is the osteochondral lesion. So this is the tibio-talar ligament. So this is the tibio-calcaneal ligament, and as you see in the other section, so this is what is the spring ligament, and this is the tibio-spring ligament. So this is the middle compartment, the spring ligament or the calcaneo-navicular ligament. It has also has the various components which I will be showing now. So there is the deepest one is the longitudinal spring ligament complex. There is an oblique spring ligament complex, and there is a calcaneonavicular superficial component. So this all constitutes the spring ligament, and this is the tibio spring ligament. So in the MRI image, you are able to see this is the calcaneum and the navicular, which constitutes the calcaneonavicular or the spring ligament complex. It is very difficult to see all the three ligament components separately on the MRI. Coming to the posterior ligament complex, so the most proximal, the S1 which is indicated is the syndesmotic ligament, which you are able to see here. And then there are other two ligaments which commonly seen in the MRI are the posterior tibio fibular ligament. So this is the tibiofibular ligament. Similarly, postal there is the posterior talofibular ligament, which I have already shown in the previous slide. There is another ligament which is called as the calcaneofibular ligament. So if we and then on the medial side posteriorly there is the posterior tibio talar ligament, tibio-talar, and the tibio calcaneal ligaments. So which are nicely seen over here in the same MRI images. Uh, this is an image of a gradient sequence where we need to see the cartilage. So this is the tibia, this is the talus, this is the calcaneum, these are the metatarsal bones. So in between the bones, you are able to see this bright signal, so which is quite uniform in all the joints. These are the cartilage. So the in gradient imaging, we are able to see the cartilage very nicely, and this is a normal joint without any involvement of the arthritis. That's why we are able to see the uniformity of the cartilage. This is the sagittal image where you are also able to see the Achilles tendon and the plantar fascia. This is an example of abnormality where there is a calcaneonavicular coalition. There is a complete osseous coalition which is seen in the sagittal as well as the coronal plane. This is an example of posterior tibial tendon thickening, which is seen in the sagittal image as well as in the axial and in the coronal image thickening. And along with that, there is, if you see, there is loss of fat in the sinus tarsi. So this is a case of posterior tibial tendon dysfunction, whereas because of the tendinosis, there is loss of the sinus fat, and there is thickening of the tendon. So, whenever we conclude with the MRI reporting, so we should talk of the bones, we should talk of the different ligaments, which I already showed you. Then we should talk of the tendons, we should talk of the plantar fascia and the Achilles tendon and the varus fat pad. So, this completes the systemic assessment of MRI of the ankle, what we all need to see, how we need to perform.